You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hi, everyone. We're back at Stellar Success Podcast. Today, Dr. Parmar from Maryland is here to tell us a little bit about her interesting combination of being a dentist and working in a sleep apnea study center. How are you, Dr. Parmar?
Oh, nah. Sorry about that.
How are you?
I'm doing wonderful. Thank you, Dr. Tudor. How are you?
I'm great. I'm great. So it's interesting for me that you are a dentist, but you work in a sleep center. How did it come to go this way?
Well, I think it was a basic question of asking why we do what we do in healthcare and affecting your own self, family members. You question why, what does healthcare um, helping us do? So as a dentist, I had a very thriving practice of general dentistry. And then there were a lot of failures of what I was doing. And I said, I still don't know much about dentistry, because if we are fixing a problem, there should be a long-term solutions. And that led me to believe that there's something that I still don't know. Went for further education. I got my fellowship in TMJ. And I used to treat a lot of TMJ patients, and I still had some was great success, some were failures, and say, success is great, but what can I learn from these failures? And that led me into the rabbit hole of understanding, and I was trying to get to the root cause, which led me to understand sleep and sleep apnea and what are the effects that were happening into patients' mouth. And we had a very myopic view of fixing just teeth, where on the other end, the person was trying to survive. There was contradictory things that we were looking at.
Yeah, very interesting. So you have a very extensive experience in what you're doing right now. What do you think is the main reason that people don't understand what sleep apnea is and how to treat it?
So the major hurdle with this disease is, and it's an irony, because the sufferer doesn't know. It's the observer who tells them. And 3/4 or more time, it is your significant other who you normally take for granted. So their complaints are mostly ignored. When they go outside that comfort zone with friends or other family members, when they complain, it kind of puts a question mark in their thing, and it becomes kind of a social stigma. And that is when people tend to take more action, or it is affecting them so badly that they just cannot function in day-to-day work life.
Yeah. How did you end up in this center, in this specific center?
Oh, I am not in the center. I own the practice.
Yeah, that's my question. How did you end up like working towards your business to create this center?
So what happened during COVID was everybody was very scared when COVID hit. I had been doing side-by-side practice, general dentistry, and doing dental sleep medicine for a while. But when COVID hit, my family members became very insecure about me telling people, open your mouth, and yes, I'm going to work in it. And I saw the need, the growth and the need in sleep world to get the treatment is so high that I just decided to close my doors for general dentistry and said, okay, this is what I'm going to do full time. And it has just blossomed to the place where I wish we can just continue to do this for a long, long time to help people get their lives back.
Very interesting. So, tell us a little bit about this mix of, I would say, a successful practice, private office, and you being, used to treat patients as a dentist. How do you mix those business side with the medical practice side?
So it took me a while to transition over. And one of my mentors, when I started doing dental sleep medicine, said, "Don't think like a dentist." That was his mantra to me. And by that, I understood, don't have a myopic view of just fixing teeth. And I've always practiced a holistic dentistry, understanding the patient from head to toe. And I've always told people, teeth don't walk into my practice, people do. And you have to remember that it's head, shoulders, knees, and toes. Everything is connected. And that led me to understand the medical side of it. And it took me deep dive into the medical world of understanding, doing the billing side, and creating that bridge to give collaborative care for the patients. Even though people think you're still a dentist, and I say I'm a hybrid. So I'm a bridge between medicine and dentistry.
Yeah, it's very interesting, and I would say an example of a successful transition from being just a dentist, like you said, to get to this type of business that you're in right now. And the fact that you just mentioned the fact that people are getting into your office, not teeth. I like that, and you have to look at them as a human being and as an body functioning from head to toe. But tell us a little bit about what you're doing right now. How do you treat patients with sleep apnea and sleep disorders? What's your approach, and what is the successful way, I would say, to do this?
So the biggest, we have different referral patterns. I have created collaborative group of ENTs, neurologists, whoever was open and was in the field who were ready to diagnose and wanted their patients to have different treatment options. The way the healthcare was set up for years and years was that the patients were diagnosed in a sleep medicine practice and they were shipped a CPAP machine. People were not basically educated and empowered to understand why they needed, what was the purpose of that machine. And when I was doing general dentistry, I always asked the key question to the patients: are you diagnosed with sleep apnea? In my screening, even though it was a dental practice, and are you using your CPAP? Over 5 years, I got the results that said out of 100% of people who were given CPAP, less than 50% had ever used it more than a month. And they were collecting all these supplies with the hoses and the mask and the filters as if they were going to set up a DME at home. And that made me ask them, were they understanding the purpose of it? And all of them had only single answer, no. Nobody ever discussed what is the consequences of obstructive sleep apnea, why they needed to treat this disease, and what does that do to their total health and their healthcare dollars at the end. And when that hit me, I said, this is what the patients are looking for. So at the end of the day, I think they're looking to have a provider that sits down, lets them understand, educates them, empowers them, and then let them make the decision, what is the treatment choice they would like to do. We don't own their disease, they own their disease. So I let the patient own their disease, and I am their guiding forces towards health if they so desire. So that's how I practice. I look at it as a gift that I give the patient. What they do with that gift is up to them.
Yeah, very nice, very nice. And also, I'm very interested in the way you started this whole journey. I'm sure you probably had some setbacks and failures in the beginning when you when you started this whole thing. Can you give us an example of something that didn't go well?
Oh, absolutely. That was my first case of I was doing oral appliance therapy, and the device of the FDA approved device didn't come the way I wanted it, and I thought I could like do it chair side, fix it, and I had to cut the whole device out of the patient's mouth, and I thought, is this what I want to do? And I said, nope, we're going to persist because there's a lot more people. This is how I'm going to learn, and that was my step up. So we told the patient what is the reason, what happened, and we moved forward. We always will have failures, but what we take out of the failures made me step up and move forward.
Yeah, that's great. That's a great example. Um, when you move into this type of business, and you're a solo practitioner, basically,
Yeah.
in a field that it's very, I would say, controversial in terms of diagnosis, in terms of treatment, and it's not really recognized as an own specialty right now. How do you manage to collaborate with other physicians to make them understand basically what you're doing and how the referrals are made and to send you patients and to, have this kind of relationship between them?
So I started by doing some lunch and learns um, with the neurologist, with sleep physicians, with primary care physicians, and make them understand. We all understand our Medicare world where MIPS is the big thing, and patients who are not controlled with high blood pressure and the hospital readmissions and diabetes control, where they are getting dinged, but they don't have time to screen these patients, to get their sleep study done. And with the severe shortage of sleep physicians in the field, people are going through the ringer to get to in the right direction, to get the help, get the treatment, and get them towards that healthy stop. So I started educating them. I started to informing them what are the medical insurance requirements, what is it that I need from them, like face to face before the patient gets the sleep study, the post visit of discussion of treatment, the prescription for the treatment, if they have tried or failed CPAP, those notes. So those are all the medical necessities along with the prescription that I get so I can help these patients get their obstructive sleep apnea under control with the treatment with the FDA-approved therapy for
I
all
see.
clients, basically.
Yeah. Um, do you have the model of insurance for everything that you treat, or do you adopt any kind of self-pay model?
No, I am in network with almost all different insurances, and I have a deep understanding of each insurance, what their requirements are for payment for oral appliance therapy, for their diagnosis of the disease. What is it that some will take the AHI as a diagnostic parameter, some will take RDI as a parameter, some insurance will follow just the Medicare guidelines for the parameters. And so I have both sides of it. If my hands are tied and the patient doesn't want a certain kind of device, which is mandated by the insurance companies, we give them the choice. This is what your insurance company approves, pays for. This is a different model, and this is what you will have the cash payment for. So we don't judge a patient's pocketbook. We let them make that decision.
I see. What do you think it's the amount of difference that you made in patients' life by treating them like this?
It
Because,
is.
I'm thinking, everybody is happy in their life if they sleep well. If they don't sleep well, the whole day goes sideways for some reason. So I'm thinking the satisfaction rate in this type of business is very important.
Oh, absolutely, absolutely. It is one of the most satisfying thing to hear where people come and say, "You saved my marriage." People say, "You saved my life." People say, "My quality of life has changed. I'm more productive. I am off my anxiety and depression meds." I just had a patient the other day tell me, "My psychiatrist is shocked that I am off of all these meds now." So we have one of the biggest problem in this sleep medicine world is we have certain educational biases. We have certain sexism in diagnostic criterias. And this is a disease that affects a newborn to a 100-year-old. But because of our educational biases, we just let people get missed out on a lot of diagnosis, and they all are seeing different specialty because of our siloed healthcare. And each one is treating the person differently. So the way I look at it, the brain doesn't know where the heart is, the heart doesn't know where the lung is, the lung doesn't know where the kidneys are, and the patient keeps roaming around in circle. So on an average, I see a patient who has seen 4 healthcare providers before they find and say, "Help me." And we guide them towards the right direction and help them get tested, treated in the most efficient manner that we know.
What do you think it makes you successful compared to other people in this field?
I think it is a human need to be listened, understood, and provided the guidance. I am not everybody's provider, but if you give people your sincere education and guidance, that is what they're looking for. And everybody in today's healthcare, which is totally insurance controlled, we have backward healthcare. From what my education was to look, listen, feel, diagnose, test, and treat, we are on the exact reverse mode. We're not listening to the patient. We are listening to insurance criteria. We're not looking at the patient. We're looking at the computers, and we are testing out of people out of wazoo, hoping to God somebody gives me diagnosis. Instead of using your intellectual property to diagnose and test a patient, we are testing a lot more because that's what we get paid for. So the focus is from the patient to the finances.
Mm-hmm. Yeah, that's true. With all the experience you have and the things that you learned so far in your career, if you would look back to the first moments when you started this whole journey, what kind of advice would you give to yourself?
I wish I had found my mentor way ahead of the time that I did. And I wish I can tell young people that this is a field that needs a lot of young people for me to pay it forward, to pass on the baton. And the navigation of insurance industry is a huge hurdle for people not to, and the corporations are owning them. So I think I am a dinosaur practice at this point that is not owned by a corporation yet.
Yeah, that's true. It's very hard to stay private in this market, especially in your field. How do you manage to do that?
By keeping our costs down and educating my team as to what is our purpose to do, to help people. And we are not looking at volumizing. I mean, the focus is not on a volume, the focus is on quality care. And that is
Very interesting.
Exactly.
Do you have any plans for expanding?
I don't know. I just have a newborn grandchild who is 4 months old, and I want to be going slower, not faster, because the fear doesn't mean better.
Yeah, very nice. Congratulations.
Thank
Well,
you.
it's a pleasure to have you here on the podcast, and I hope a lot of people are gonna, learn something from this and maybe reach out to you for more advice and see how you build up the practice you did and be successful in what you're doing. Thank you very much for being here, and I wish you many, many more successes.
Thank you very much, Dr. Tudor. It was my pleasure. Thank you for reaching out to me. Appreciate it.
Sure. Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.